right. Hello, everyone. Welcome back to Plant-Based Kidney Health. My name is Michele Crosmer, and I'm here with Dr. Sean Hashmi again. And we have a very important, complex, confusing topic to address today. And it'll be, again, another one that's multiple episodes because I think, so we're talking about proteinuria or protein in the urine. And I think it's confusing for people with kidney disease. It's confusing for a lot of healthcare professionals, for family members of kidney disease. And so I think it's just going to be really beneficial to learn about what it is and what potentially causes it. And eventually we'll get into, how it's treated or how we can help treat it, what testing can be done. So we are very, very lucky that Dr. Hashmi is going to explain so much for us on this confusing topic because I would not be able to explain it. So should we dive right into the question?
Let's do it. Let's do it.
So first of all, can you just explain for us what is proteinuria and what causes it?
Yeah. So, today's topic, guys, is going to be one I think you guys are going to probably have to watch this video a couple of times, use it as a reference in the future. So with that, let's dive in. There are two types of proteinuria I want you to remember. One is albuminuria, which is just one type of protein, and one is proteinuria, which is all types of protein. So in general, there are two references I want you to remember. The first reference is how much protein should you actually be spilling in the urine if you're healthy? So it turns out the answer is not zero. It's about 150 milligrams per day. So that's the first reference you want to remember is should be up to 150 milligrams per day. That's the normal range. The second is how much albumin. Remember, albumin is one type. So it should be less than the total protein you're spilling. That's less than 20. Now, we have a few definitions that we talk about in the past. So the first definition is what we used to back in the day, we had different names for it. So I'll give you all the names because your doctors and your renal dietitians, your kidney care team may use different terms. So the first term is microalbuminuria. Microalbuminuria is an older term. Now we say moderately increased albuminuria or moderately increased albumin in the urine. What that basically means is that you're spilling anywhere between 30 to 300 milligrams per day of albumin in the urine. So remember, normal is 20 or less. This is moderate, which means it's 30 to 300. If you're more than 300, we call that severely increased albuminuria or previously called macroalbuminuria. So it's already starting to get a little complex, but hang in there. Now, sometimes your kidney team will say, well, Mrs. Jones, you have nephrotic syndrome. So that's just a fancy way of saying is that they're looking at the total amount of protein you're spilling, and it's greater than 3.5 grams per day. So if they say nephrotic syndrome, it's greater than 3.5. Non-nephrotic is less than. Why should you care? Because your risk factors for things like blood clots in the legs, the severity of the disease, and all those things go up if you're greater than 3.5 or nephrotic. So now we know when we talk about severity, if it's nephrotic, it's greater than 3.5, or if we're just looking at albumin, it's greater than 300. Now let's talk about what does it mean when we talk about proteinuria, specifically in the kidneys? So if you look at the kidneys, think of the kidneys as this is probably not the best example, but when I explain to medical students for the very first time, this is how I describe it. It's like a ball and chain. So there are very tiny structures in the kidneys called a glomerulus, which is the ball portion of it. And then you have the tubular component that comes out. And so the tubular component is kind of like the chain that comes out of it. So when you look at protein in the urine, the protein in the urine can come out because there's damage in any one of those areas. So the first portion of the kidney is that glomerulus or the ball. And if there's damage in that glomerular portion going on, we call that proteinuria coming from the glomerular protein. Now, if it's that structure that's being damaged, you're going to see that very simply on the urine dipstick. So, the most simple test for protein in the urine is urine dipstick. It's not the best test, and we're going to get into that why in a second, but the urine dipstick is where literally they dip a stick in your urine, they pull it out, and they say, aha, it's 1 plus, 2 plus, 3 plus, or 4 plus, and we'll talk about all of that. So if it's glomerular, it will show it right there. Now, what if the damage is not happening in the ball portion? What if it's later on? What if it's happening in the tubulars? Well, if it's happening in the tubulars, then what happens there is it's other types of diseases. And those diseases are where there's smaller proteins that are really doing the damage. And those can be things like light chain diseases going on. And the reason you should care is because some of those things, they don't show up on dipsticks. So imagine you do a urine dipstick, it comes out negative, and you think you have nothing wrong with you. In fact, there could actually be a disease there, but it just doesn't show up on a dipstick going on. So now we covered glomerular, we covered tubular. So remember, glomerular, bigger types of protein, tubular, smaller types of proteins. Then there's something called overflow. Overflow proteinuria is just like it sounds. There's so many types of protein that are being formed, whether it's in the body going on, that they're literally just overwhelming the system and they're flowing out. What is the classic example? Is actually things like multiple myeloma, a type of cancer. And there's so many light chains being formed in the body that they're just spilling out through the kidneys and into the urine going on. The last one that's really important, the fourth type of proteinuria, and this is the one that confuses everybody, so you want to know this one, is what we call post-renal. What does that mean? It means it's not inside the kidney, so it's not in the ball, it's not in the chain, it's after the kidney. So where is it? It could be in the urinary tract going on. So for example, let's say you had a urinary tract infection. So there's inflammation along the urinary tract going on, and so you have some protein spilling. So in other words, you actually don't have kidney disease. You literally just had a UTI, and that's why they saw some white blood cells and they saw some protein. So it's not uncommon that somebody comes to me and they're referred because they saw some protein and they're getting so scared. They're like, oh my God, doc, I have kidney disease, but they don't. The only reason they're there is because they saw some white blood cells and they have some protein. So what do? We repeat it. That's it. The other times that you can also see protein in the urine post-renal is if they have kidney stones there. Because what will kidney stones do? As they pass, they can cause inflammation. Inflammation will cause some protein to spill there. But there's another reason why that can happen, and you can have tumors. And those tumors, whether they're in the urinary tract going on or lower down, those tumors can also cause there to be some protein spilling. So anytime we see protein spilling, the first thing is we want to make sure it's real. So we'll go ahead and check it, and we'll go ahead and repeat it to make sure going on. But if you see it, you can always see us or a urologist, and we can check it to make sure. Now let's go ahead and flip that equation. Let's say you have protein in the urine, and you're a young person or you're otherwise healthy, and you're getting very nervous, and you say, what are some causes of protein in the urine that are not serious, that are what we call benign, or basically essentially just kind of go away? Well, one of the most common causes, which is something nobody ever talks about, is dehydration. Just like that. Nobody really thinks about this, but this is so common. People come in, they're really, really dehydrated. They give me a urine sample. It looks like there's protein, because when we measure protein in the urine, it's a concentration. If you're really dehydrated, it looks like, oh my God, you have so much protein. I make you drink some water. I repeat it, and guess what? It's fine. Another one, and now this is really interesting. It's stress. If you're under a lot of stress, please don't go give me a urine sample, because it'll look like you have protein in the urine. When we're stressed, we release all of these cytokines and inflammatory markers, and they can cause you to spill protein in the urine. If you calm down, relax, next thing you know, you don't spill protein in the urine. So if you're having a really hard time at work, you're not sleeping enough and all that stuff going on, believe it or not, that can cause you to spill some protein in the urine and make the test look bad. Fever will do it. Heat will do it. Any kind of inflammation in the body will do it. Of course, exercise will do it. So we're not talking the couch potato who gets up and walks to the fridge and back. We're saying like any kind of intense activity, right? They'll go ahead and do it. Of course, if you have like any kind of significant illness, you got a severe fever or anything like that going on. Now, here's the kicker. I had a patient come to me who was a young guy. I think he had just turned 18 or 19. This is several years ago. And nobody could figure out why this, I'm going to say kid. I'm not that old, but I'm going to say kid. Why this kid had protein in the urine. And they wanted to do a kidney biopsy. He was reluctant. And he came and saw me. And I said, there's no reason to do a kidney biopsy on you. You have what's called orthostatic proteinuria. What is it? It's basically when you stand up, you spill protein in the urine. And how do you diagnose it? So you do a urine sample, basically, and you essentially wait till the end of the day. So right before they go to bed in the evening, you get a urine sample then, and then you get another urine sample when they wake up first thing in the morning, and you do it. And so you get a spot urine sample and you check their protein in the urine. And what you find is because they're standing all day, they actually spill protein. It's orthostatic, it's postural. Versus when they're laying down, they don't spill protein. Their diagnosis is benign, nothing happens, and they're okay. And you just follow them along. So that's orthostatic. So now you have all these causes for benign. So now let's flip it. What are some causes for not benign? In other words, what are some causes that actually are serious that you want to know? So first, let's talk about the ball area. Remember we said ball and chain? So on the ball area, there are certain diseases that we call primary glomerulopathies, which means these are main things that affect the glomerulus. Those are things like minimal change disease, autoimmune conditions, membranous, FSGS or focal, segmental, glomerulosclerosis, that's a mouthful, membranoproliferative, IgA nephropathy. These are all types of diseases where essentially your immune system is turning on itself. It's attacking the kidneys, going on for a multitude of reasons. Some we understand, some we don't. A lot of times we use immunosuppressants to treat those, but the thing that they all share is you're spilling protein in the urine going on. Now, the secondary causes are usually because there's a secondary disease that's then attacking the kidneys. For example, the most common one is diabetes, right? Diabetes will attack the kidneys and then cause you to spill protein in the urine. Lupus. Lupus is a collagen vascular disease. Lupus will attack the kidneys and cause the kidneys to spill protein. Amyloid. People can have preeclampsia going on. Infections like HIV, hepatitis, syphilis, malaria, endocarditis. These are all common things that will lead to protein spilling in the urine. Lots of cancer, right? There's lymphomas, lung cancers can do it, GI cancers can all lead to the kidneys and spill protein in the urine going on. Now, what about drugs? There's a number of drugs that can also do exactly the same thing. Most common things are NSAIDs, right? Motrin, Aleve, etc. If taken in excess over long periods of time, they can do that. Some people can just have a reaction to them, and that can do that. Lithium can cause you to spill protein in the urine. You know, when we talk about supplements and we say, listen, if you're going to take something, be very careful about the capsules, because oftentimes the capsules are unregulated and they can have heavy metals. Those heavy metals can cause you to spill protein in the urine going on. Other thing is drugs like heroin can do that as well. So those are all things that can affect the ball or the glomerulus. What about then the chain, or what we call the tubular portion? Well, tubulars are affected by very simple things like blood pressure. But another thing is things like uric acid. And what causes uric acid to go up? A few things. Meat is a big culprit. High fructose. So when Michele is always talking about eat fruit, don't drink your fruit, meaning don't start drinking juices. There's a reason for it, right? Juices, it gets rid of the fiber, gets rid of the water, and all it does is concentrates all of the fructose together, so you're just getting nothing but fructose. That's why our motto is listen to Michele first. So as you think about that stuff, you want to avoid high fructose. You don't want to avoid fruit. There's a big distinction there. And same thing with things like alcohol. So uric acid nephropathy will lead to damage of the tubules, and that will cause what? Protein to spill in the urine. Sickle cell disease will cause protein in the urine. A lot of antibiotics will damage the kidneys, specifically in the tubules going on. And then, of course, cancers like multiple myeloma can do it too. So that is your big overview of what causes protein to spill in the urine. And as you think about it, remember, ball and chain is the kidney. So damage can occur in the kidney, but protein in the urine can occur not just because of kidneys, but because of damage after the kidneys.
Okay. Wow. That's so helpful. And I think one of the things, just to kind of go off what you're saying is, and correct me if I'm wrong, but obviously someone who has, let's say they have FSGS and it's, damaging that ball, but then they also have high blood pressure, which can then be impacting the tubules. So it's almost regardless of what form of kidney disease you have or what the initial cause of of kidney disease is, some of those secondary things like high blood pressure, high blood sugar, or inflammation are so important to control because it could be contributing to more protein spilling into the urine.
Absolutely, right? It's such a complex topic because all of these things, they lead to each other. And a lot of this stuff then leads back to what are you eating? How are you moving? How are you sleeping? Because there's stuff that you can't control. But then the stuff you can control, if you're not watching out for that, that's going to feed right back into making either things worse or making them a lot better.
Yeah. And someone asked a question, and actually multiple people have asked this, but their question is if you see bubbles in your urine, is that a sign that there's protein in your urine?
Yeah. So generally speaking, the answer is yes. But I will tell you, a lot of people have bubbles in their urine. I have bubbles in my urine. And so most people in general have bubbles in your urine. So don't freak out. Number two is if you haven't had a physical, you should have a physical, and part of your physical is just get a urinalysis done. And we'll talk about urinalysis most likely either in this episode or another episode. But when we do, we'll talk about which type of stuff to do. But a simple dipstick will go ahead and tell you if you're spilling protein or not. But in general, a lot of people have bubbles. But if you have a lot of bubbles, meaning it looks like, those when you're getting ready to wash dishes and there's like soap everywhere and it's all, that means that most likely you have protein in the urine. And when we're treating patients, what we tell them is you will be able to see the severity of the bubbles go down as a way to tell the treatment is actually working. So yes, bubbles are a sign of proteinuria, but at the same time also realize it's actually common for people to have bubbles.
Okay. Got it. But a lot of bubbles, foamy and soapy type of bubbles are not good. And you already addressed on someone had also asked, is there anything aside from, kidney disease, kidney damage that can cause protein in the urine? So you discussed that, I guess, especially since you mentioned, the importance of a urinalysis. What's the difference then between, or I guess how should someone know if they're getting the right urine tests done? Like what are the different ones and what's the difference between like the protein urine and then creatinine urine and then protein creatinine ratio, and it can be so confusing.
Yeah, let's dive into this. So let's start off with the two types of tests that you can do. So there is the qualitative test and then there's the quantitative test. We like to use fancy terms. So qualitative just means that it gives you a plus minus kind of thing, meaning you have something or you don't, but it doesn't tell you how much. Quantitative gives you a number. It tells you exactly how much. So on the qualitative side is the urine dipstick. That is the one that gives you 1+ to 4+. It's actually not true. It's not 1+. It's actually 0 to 4+ technically, right? Because 0 would be you don't have anything. So what it does is the urine dipstick is really only detecting albumin. So remember we said albumin is one type of protein, but there are many types of protein. So it is only trying to detect albumin. But remember, where is albumin really coming from? It is coming from what we define as the ball or the glomerulus, right? So if there's stuff in the tubules, it might not actually be sensitive to that. So tubular proteins, it might not be sensitive. So the other thing is really, in terms of the smaller proteins, it's not going to pick it up. So the other part of this is in terms of what does 1 plus mean, what does 2 plus 3 plus 4 plus mean, we don't have a very good idea. What a good estimate is that a 2 plus on a urine dipstick would actually be equivalent to about 500 milligrams of protein to creatinine ratio. That's what it would be about equivalent to. So that's just to give you an idea. And when we look at patients who have kidney disease, who are spilling protein, what we want to target is a target of less than 500. So in other words, normal protein to creatinine ratio, we're trying to get them less than 200. But when they already have protein, if we can get them less than 500, what the data shows is their risk of progression goes down a lot. So less than 500 is really where we want to be. Now, what is the problem with urine dipstick? Well, a few things. First, if you're spilling blood, so for example, in women, if they have their monthly cycle going on, if there's blood in the urine, it will give you a false positive. So it will look like there's protein in the urine when there isn't. So you don't want to do a urine dipstick if there's blood in the urine. Number two, if the pH of the urine is high, let's say the urine pH is like greater than 8. If that's the case, you don't want to do it. If you've had any kind of imaging done on the body where they had to give you any kind of contrast, what we call iodinated contrast, you want to wait at least 24 hours because the contrast will affect the dipstick urine itself. So you don't want to have your dipstick urine done within 24 hours of getting any kind of contrast study. So that's really important going on. Now, the gold standard when it comes to doing any kind of urine test is a 24-hour urine collection. That is the gold standard. But how come we don't do the gold standard all the time? Because frankly, 9 out of 10 patients do it wrong. This is really important to understand. You can truly mess it up. So what is the right way? And I'll tell you this, and you want to make sure that if you do it for your doctor, please do it correctly. Number one, you wake up in the morning, you go use the restroom, you let all of that urine go into the toilet, you flush it, you're done. From that point on, that is time 0. After that, every time you pee, it goes into the jug. Because when you wake up in the morning, that is all the urine from overnight. That has to be discarded. So that's time 0. Now you collect throughout the day. It has to be refrigerated. Then you wake up in the next morning. Remember, that got collected overnight. That has to then, when you pee the next morning, has to go into the jug. You have to go ahead and store it, and you have to bring it to the doctor's office. Now, it's really hard for people because imagine, even if you do it on a Friday, like who the heck wants to, carry a jug to work and so forth? And, if you do it on a Sunday and you got to bring it in, so forth. So it's difficult, and we understand. But there's a reason why we ask people to do it. Now, what's the next best thing before we come back to this gold standard? So the SPOT, protein to creatinine ratio, or the SPOT, microalbumin to creatinine ratio, is the alternative. The reason that we use that is because it gives us an idea about as close as we can get, but it has a lot of limitations. So if you want to get the best results out of it, please, please, please do it first thing in the morning. Okay? So in order to get the best results, do it first thing in the morning. Now, there are limitations to this test, and the limitations are that it is really this SPOT protein to creatinine ratio, or the SPOT microalbumin to creatinine ratio, it is heavily dependent on the creatinine concentration. So imagine if you're a bodybuilder like me. That's a total joke. I am nowhere near a bodybuilder. I'm actually quite skinny, so I should give you the other estimate. But let's imagine that I am a bodybuilder and I'm like 250 pounds of just pure muscle, like 4% body fat, all that good stuff, right? Because of that, I produce a lot of creatinine. So as a result of it, my bottom number is actually going to be very high. So what's that going to do to my ratio? It's going to make the ratio smaller. So I'm going to underestimate my total protein to creatinine. Let's do the opposite. Let's say I'm somebody who is elderly and frail. I don't have a lot of muscle. So because I don't have a lot of muscle, I don't produce a lot of creatinine. I make that bottom number very small. Therefore, it makes it seem like, oh my God, I'm spilling so much protein in the urine. Why should you care? Because imagine if you overestimate how much protein you're spilling, you scare the bejeebies out of your doctor gives you too much medicine. Or if you're a bodybuilder and you truly are spilling a lot of protein, but your doctor doesn't give you enough medicine, and he or she undertreats you, and now your kidneys continue to get worse. Isn't either one of those situations bad? So when you first go see a guy like me or a gal like me, when you first see a kidney specialist, I think it's very, very important that when we ask you the first time, please do a 24-hour urine collection. The first time, do it. Because that first time will give us an idea of what's your starting point. After that, you can do the spot protein creatinine or microalbumin creatinine ratio, and it's perfectly okay. But in order for us to make sure that we know where you're starting and so we give you the right amount of medicine, it's going to be very, very important. So that's how you end up deciding urine dipstick or microalbumin to creatinine or protein to creatinine. And remember, a dipstick is looking at albumin, which is one type of protein. But imagine if you have multiple myeloma, which is a type of cancer. It's putting out light chains, which are not albumin protein. They are immunoglobulin proteins. Those would not be picked up by a dipstick. So dipstick will only pick up albumin type proteins, nothing else. So this is why we do microalbumin creatinine or whatever other kinds of stuff. But a dipstick is very, very simple, and it only is a limited type of test.
And then just to clarify, so with the 24-hour urine collection, you're still testing the microalbumin creatinine ratio. It's just that it's more accurate because, okay, so what's then the difference that you're testing in that versus?
We're doing a quantitative amount of albumin and total protein in there. So in that total collection, we will measure the total amount of creatinine in there. We will measure the total amount of protein in there. We will measure the total amount of albumin in there. Okay. From that, we can do the ratios and do any other thing that we want to get an idea of. So we can get the ratios, but we can also get the total amount of protein you're spilling.
Okay. Got it. And it's more accurate because versus the spot one, it's depending on the time of day and obviously your body mass, then it's not going to be as accurate.
So the word accurate it's tricky, right? In the sense that, are you really doing it 24 hours? Right? In other words, if you don't do it for the exact 24 hours, and let's say that you only did it for 20 hours, that could make a big difference.
Yeah.
Right? So let's say that, you went and you peed at 6 a.m. and then you started collecting. So that's fine that you did that. But then the next morning when you woke up and you slept in later and you did the last sample and you peed at like 10 a.m. Well, now that's like 30 hours. You threw my entire 24-hour collection off. So the problem with the 24-hour test is most of our patients, they end up messing it up. And that's why a lot of nephrologists, they just throw their hands up and they say, most patients don't do it right. And as a result, because we don't know, we may actually mess up our treatment decisions and give them the wrong dosing based on that.
Got it. Okay. That makes a lot of sense. And I have one more question that, of course, in the next episode, we're going to go in more of the treatments. But when you look at, like the National Kidney Foundation has that, grid that shows the stage, based on your GFR and then how much protein is leaking in the urine, they show kind of your prognosis for kidney disease. So why is the presence of protein in the urine and the amount of protein in the urine linked with someone's like prognosis or progression or severity of kidney disease?
Yeah, so the single most powerful predictor of going on to dialysis over 10 years is protein in the urine, study after study. So there was a study in 2013 by Chowdhury and colleagues, and what they showed was that in a 40-year-old men and women who had no protein in the urine, they lived 15 and 17 years longer than those that had heavy protein in the urine. Just think about that for 1 second. You're talking 15 and 17 years longer. That's a long time. And then those that actually had mild protein in the urine versus those that actually had heavy protein in the urine. The ones that had mild protein in the urine lived 8 years and 10 years longer. The men lived 8 years longer, and the women lived 10 years longer than those that had heavy protein in the urine. So in other words, protein in the urine, not only is it the biggest risk factor for dialysis, it is the biggest risk factor for death. That's how it's significant.
Because of inflammation, or is that just because of the amount of damage, like it's showing the level of damage, or do we know?
This is a great question. I think it's probably all of the above, meaning there are so many things that happen inside of our bodies. And that's why whenever you have protein in the urine, you have to see your nephrologist and the entire team, and you have to get it under control. It is absolutely vital simply because it cuts into your life so much.
Yeah. Okay. Well, I think that's a good place to wrap up. Just like you said in the beginning, I think that this is a really good episode for people to listen to multiple times or watch multiple times, because really understanding what proteinuria is and the different places of the kidneys or even post-renal that it can occur, and the levels and the testing for it. And then just why it's so important, I think is really good to understand, because it's just an extra step of, knowledge is power, and taking control of your health and having that be part of, your spreadsheet of your blood work and labs. You also have your spreadsheet of your urinalysis and your test results that you're monitoring trends of. So thank you for explaining that to us, in such a way that's, as simple to understand as possible. And we are going to have at least one, but maybe two more episodes on proteinuria, and we'll dive into, treatments and food and nutrition with that. But again, just in general, if you guys have questions that you want to submit for us to talk about in upcoming episodes, you can email that to plantbasedkidneyhealth@gmail.com. Of course, we can't answer individualized, give individualized advice or recommendations, but topics and questions, just like this episode, we get a lot of questions about proteinuria and bubbles in the urine and what the tests even mean. And then we can turn it into one or multiple episodes. So that's plantbasedkidneyhealth@gmail.com. And do you have any final thoughts?
No, just, we would really appreciate it if you guys would spread the word.
Yeah, if you guys can share this, subscribe, like, leave a comment, rate us, we would appreciate that. And we will see you guys next week with more on proteinuria.